cases now reported in nearby states such as Rhode Island and New York. So let's talk about what is going on now. I would assume that inevitably we will see cases here in Connecticut.
Yes, yeah, and I'd like to thank you for having me. I appreciate the invitation. So yes, I think we will see cases in Connecticut. We can't, be sure, but it is around us now, as you said, in New York and Rhode Island, and so I think more likely than not, we will see some cases.
Yeah, it'll be difficult to avoid coronavirus once it's so close by. So let's talk about the difference, because I know a lot of folks want to know, what is the difference between the flu and coronavirus?
Well, they're different viruses, and the flu and coronavirus are similar in that they're transmitted by respiratory droplets. So if someone sneezes or coughs and the droplets that they cough or sneeze out get in your nose, your mouth, or your eyes, then you can get either flu if they have flu, or you can get coronavirus, COVID-19, if they have COVID-19. So they're similar in that way. They are also similar in that they have a spectrum of disease where you can have mild symptoms, fairly mild symptoms, feel quite lousy but get better at home within a number of days. And we have the situation where some people get severely ill and can require hospitalization, and they can both be associated with death. And severe disease and death is more likely in people who are older and people who have underlying conditions.
Let's break it down regarding coronavirus. And coronavirus, so it is something that the symptoms for coronavirus, oftentimes you don't exhibit them. Is that right?
Well, I think that usually people do have symptoms. There probably is some asymptomatic transmission. I think it's hard to know how much, what the total spectrum of disease is, but the symptoms that have been identified to be common would be cough and shortness in breath and fever.
And is coronavirus deadlier than the flu?
Yes, the death rate in a regular flu season is about 0.1%, and the death rate with coronavirus is 2%. So that is 20 times higher. However, most people who get coronavirus and who are healthy, 80% of people will resolve their infection without needing to be hospitalized and without being at risk for death.
All right, before we get to the ones who are at risk for death, those who do get coronavirus, the healthy ones, what is the treatment?
There is no treatment available right now other than supportive treatment. Basically getting enough fluids, taking Tylenol as necessary for aches and pains, and maintaining isolation as you're asked to do so by your public health authorities and your primary care team who takes care of you. Those are the things you can do.
So treatment is similar to treating the flu for somebody who's healthy.
Correct. With flu, there is also oseltamivir or zanamivir, which are antiviral medications. There is not an antiviral medication that's been proven so far to be effective against COVID-19, but there are agents that are undergoing investigation.
Yes, and we also do not have a vaccine for coronavirus, which right now I understand President Trump is really pushing many of the major drug companies to come up with a vaccine.
Yes, their work is ongoing in that. The issue with vaccine is that it will take a little while to develop the vaccine, and then the vaccine has to be trialed on people to look at the side effects and the efficacy before it's rolled out to the general population, and that will take some time.
Could take months.
Yes, could take months or even longer.
Let's talk about the folks who are affected most seriously with coronavirus. We are looking at people who are generally 50 and older with underlying chronic conditions.
Yes, people who have immunosuppression either because they have HIV or because they have cancer or organ transplant recipients and have to be on immunosuppressive drugs, people with cardiovascular disease, meaning heart disease, lung disease, diabetes, hypertension, those groups of people are at increased risk for severe disease.
So what can those people do?
I think they can do what we all should be doing, which is to try to wash your hands as much as possible, avoid bringing your hands to your face without washing in between, stay away from other people who seem sick, keep your distance of at least 6 feet or more when you're in the presence of someone who may be sneezing or coughing. Those are some of the things that can be done.
I've also been reporting to everybody that when it comes to face mask should really be for the person who is sick, not for someone who is healthy.
Yeah, that's a very good point, Jocelyn. The face mask that you wear, a regular surgical face mask, the viral particles are very small and they will get through the face mask. The face mask is best used for people who are sick with COVID-ID, so that their droplets that they're shedding when they cough or when they sneeze are not coming out other people around them and exposing other people around them.
But the surgical mask to which you were just referring, those are not the ones you should be wearing anyway. Is that right? If you are sick?
Well,
is there certain types of face masks?
Yeah, there are different
using?
types of face
Yes.
masks. So people with the COVID-ID viral infection, if they are in the presence of other people, and not in a negative pressure situation, should wear the mask so that their droplets are kept inside the mask and not exposing other people. Healthcare workers who care for people that have a COVID-19 infection would be fitted for a special mask called an N95 mask.
We've heard a lot about that.
Yes, and those would be effective in keeping the smaller particles out, but those have to be fit tested. You can't just put one on and expect that it's fitted to you appropriately without the appropriate kind of testing being done.
Let's say someone presents themselves to the ED with all those symptoms that you just mentioned linked to coronavirus. What happens once they're in there? I understand there is a negative pressure isolation room, which they will probably find themselves in.
Right. Well, the first step we want to do is that basically you want to ask at the point of entry or the first point of contact of a patient with a healthcare system, you want to get a travel screen done and find out if the patient has the symptoms, cough, fever, shortness of breath, and if they've traveled to a country that's at risk. If so, and if then it is discussed with the state health authorities as to whether that person should be tested. And if the decision is made that the person should be tested, we would want them to come into the ER and be put into a negative pressure room. Or it doesn't have to be an ER if the patient is not extremely ill, but a negative pressure situation if possible, so that the testing can be done in the negative pressure environment.
What happens in that room? What exactly goes on?
Basically, the air is actively taken out of the room. So many exchanges per hour
talking
are
about
made of
airborne
the
illness
air.
here.
Right, and so that the air is basically sort of cleaned with the patient in the room, and also the healthcare provider that would be doing the testing, doing the oral pharyngeal swab and the nasal pharyngeal swab, would be wearing their protective gear, which would include a gown, gloves, a face shield, and an N95 or other certified respirator.
And what happens after that?
It depends upon the condition of the patient. Right now, testing is available through the state of Connecticut. It was only available through the CDC. Now it is available through the state of Connecticut, and the turnaround time varies a little bit depending on the time of day the testing is occurring. Before 10 a.m., you can expect to get the result that day. After 10 a.m., it may be another 24 hours to get the result. And depending on how long it's going to take to get the result, if the patient is not severely ill and is someone that is determined that discharge is appropriate for them by their physical condition, then they could be at home while they're awaiting the testing. If someone is ill enough to come into the hospital, then they would be admitted to a negative pressure room.
Oh, so that is where they would be. They would not be taken to the ICU or any place like that.
Well, we have negative pressure rooms, and I think most healthcare facilities do about the hospital, not just in the emergency room, but in different areas of the hospital, including in the ICU.
Okay.
And so the patient would be, once the disposition is done in the ER, the person would be then transported to a negative pressure room.
Is there anything someone can do to boost their immunity?
I don't think there's anything proven that you can do other than it's always good to get appropriate rest, appropriate hydration, and have a good diet, because I think that keeps you in good health overall, and keeps your immunity functioning at its best level.
The reason I ask that is because I know so many people who are now really looking at taking more vitamin C, elderberry, anything that could really help them feel better about their health.
We don't know what might happen in the future, what we might find in the future regarding this new evolving situation that we have, but at this time I don't think there's any evidence to suggest that any of those interventions are going to be helpful.
Very good. Let's get to our questions. And if you do
Sure.
have a question, please be sure to put it in the comment section because we would love to answer those questions for you. So Dr. Wright, this first question is from Michael in Suffield. We hear a lot about washing our hands to fight the coronavirus. Is the antibacterial soap better than regular soap to use for that? And we actually have some of the antibacterial soap right here. This has been a godsend, I think, for a lot of folks.
Sure, and for a lot of different infectious diseases as well. I think that either one, if you want to use an alcohol-based rub, if you're going to use a type of soap like the Purell, and you want to put a good amount of it on your hands, and you want to rub your hands together and distribute it around the hands and use it until it dries. The other option is to use a soap and water, but you want to clean your hands for an appropriate amount of time, which would be about 20 seconds, or some people would say if you sing happy birthday to yourself 3 times, that's an appropriate amount of time to wash your hands. And then obviously dry your hands, whatever you dry your hands with, put it in a disposable container.
Exactly, and of course when you wash your hands, make sure you're washing under the fingertips as well.
Yes, yeah.
And that's so important, and why is that?
Well, I think it's important to cover all the surfaces of your hands because bacteria and viruses can be, on all the surfaces of your hands.
So perhaps now is a good time not to shake a lot of people's hands? If you want to be careful, or is that too much?
That might be prudent. I mean, I think you have to go with what as of this time, there have been no cases in Connecticut. As we said, the likelihood is that there will be, but you have to go with what you are comfortable with. And
yes.
I know a lot of people who in flu season, even with just the flu, don't shake hands.
I agree. I'm that way.
So I think that's reasonable.
Especially at church.
Yeah.
Yes. Okay, very good. And our next question is from Denise in Manchester. Is Connecticut safer from the spread of coronavirus because we do not have an airport that welcomes flights directly from the affected areas? And some of the affected areas we're talking about is Korea, China, Italy, Iran.
Right. I think that if a person has been exposed by traveling to an area where there is COVID-19, whether they come through an airport or state or not, if they're coming back to your state, if they've come from one of these areas, it's possible that they're going to have been exposed to the coronavirus and they're going to develop symptoms.
Yes, so when they do arrive from any of these countries, they are tested and they test negative. Can they eventually test positive a few days later or 10 days later?
I don't believe that we're doing testing other than if the patient is symptomatic at this time.
Okay.
So people, I think, are given the education that if they're returning from a country where there's coronavirus, where there's COVID-19, that they should monitor themselves carefully, and whatever quarantine or guidance is given by the state that you're living in and or the CDC, you should follow to make things safest for yourself and for the people around you.
So it could be when you arrive and you test, and you're given the test and you test negative, you could down the road actually show symptoms, and that is when you need to be more responsible.
Right, and again, I don't believe that people are tested on arrival. They're asked to look for symptoms, and depending on the symptoms they develop, they may be asked to put themselves in isolation. And some people might be asked to put themselves in quarantine before they develop symptoms, and then it would be after developing symptoms, if you meet the criteria of the CDC, that you would get tested.
I guess I was thinking, you're right, not to test for COVID-19, but they are monitoring them closely for a temperature.
Oh, yes, right.
That's what they were
I'm sorry, I
checking.
misunderstood
Yes,
you.
they were checking people when they
Sure.
arrived or when they're in the plane. They're monitoring all the vital signs
Sure.
in case they were developing something.
Sure, yep.
Very good. All right, so our next question is from Chris in Milford. How is the coronavirus treated if a person is diagnosed? Is there medication that someone with coronavirus is given? Is there medication?
Sure.
You and I touched upon this, but let's go ahead and answer that again for
Sure.
folks.
For the treatment for coronavirus, COVID-19 at this point is supportive treatment. So that means similar to if someone is sick with the flu but is not demonstrating signs of severe illness, you would take it easy at home. You would use Tylenol for fevers. You would hydrate well until you become better. And that would be at the advice of the state health authorities as to when you would be considered to be resolved of your illness and no longer a risk to transmit the illness. If you have more severe illness and require hospitalization, and in the worst case develop a severe pneumonia or other severe disease that requires intensive care support, then you would be supported in that environment with what's necessary to support you through the illness. Right now, there is no proven treatment, but as we were saying, there's active intervention going on with antivirals. There's
an experimental drug right now that they're looking into.
Well, one drug they're looking into is an antiviral called remdesivir, and that again is under trial right now.
Exactly.
So it's too early to know whether that is going to be something that's going to be helpful for people.
Let's say that they really put a fast track on this. What's the time frame when we even think of that process? Could something be produced in a matter of months because of the priority?
I think if it's proven to be effective and the efficacy of it outweighs any bad toxicity of it, then it could probably be put into production pretty quickly. Whether it's weeks or months, that I'm not certain of.
Our next question is from Allison in Cornwall. How long does it take for someone diagnosed with coronavirus to no longer be contagious once they are treated?
This is a very good question, and I think it's a question that's undergoing active investigation and evaluation, looking at the people who already have COVID-19 both in the United States and throughout the world. I think basically you go with the public health authorities' decisions on when the person is no longer contagious. So that could probably vary. I would say it would be in the realm of a couple of weeks, but I can't say that that's the absolute outside time.
I think it would have been 12 to 14 days is what they've been talking about.
Yeah.
But this is a fluid situation because we don't know a lot about coronavirus. So that could actually change as we get more information, more statistics, all the information you need to know to make some decisions.
Yeah, that's correct. And also people who are immunocompromised sometimes will shed virus longer than people who are not. So you really can't necessarily come up with a blanket number of days for everybody.
Exactly. It would depend on the person and the case.
Right.
And I just want to remind everybody, please send in your questions and put it in the comment section. We will get that answered for you. From Judith in Niantic. Her question is coronavirus destined to be seasonal like the flu, or will we have to worry about catching it year round?
Yeah, that's another great question, and I don't think we have the answer to that yet. I think we're gonna have to see as things unfold over the next several months whether this is going to be an illness that will come and go with the seasons, or whether it's going to be something that's more of a year-round situation.
Like we said, we still don't know a lot about coronavirus. What's the information that they need to make more sound decisions?
I think they need to see how it unfolds. We are just starting to see the cases here, and I think we need to the scientists at the CDC and the epidemiologists need and are in the process of closely monitoring how things evolve. How are things evolving in China? We know that there are a decreased number of new cases daily in China now. In fact, there are more new cases worldwide outside of China daily now than there are in China at the time being anyway. So I think we need to see how this what the natural history, how this works out over time.
In the meantime, let's just remind everybody what they need to be doing is washing your hands.
That's right.
Frequently.
Yes.
And properly.
Right. Keeping your hands away from your eyes, nose, and mouth unless you wash your hands. Staying away from people who are ill. If you are ill, staying home and coughing, if you have to cough, into the crux of your elbow. If you sneeze or you need to blow your nose, doing it with a Kleenex or something else that you can then take and put in a receptacle that you can close, a trash bin that you can close, and then wash your hands well.
Very good. Dr. Stephanie Wright, thank you so much for joining us.
Oh, thank you for having us.
We appreciate the fact that you were down here, took that drive down from Hartford. Dr. Stephanie Wright with Hartford Hospital.
Thank you.
And thank you all for watching News 8 Now.